Hello, everyone. Welcome to today's webinar on managing anxiety and depression when living with a serious illness. My name is Andy Esch. I am a physician and I'm a consultant to the Center to Advance Palliative Care. And I've been working in palliative care about 20 plus years and with the Center to Advance Palliative Care for about 8. And this topic is an important one to me because in doing palliative medicine for as long as I have, and we'll go into some about what exactly is palliative care, but doing it as long as I have, anxiety and depression are far more common than I think at least I originally understood at the end of my medical training, and have such a profound impact on the way people experience living with another serious illness, whether that be cancer or heart failure, pulmonary problems, lung problems, something like that. So this is a really important topic, and I appreciate you all being here today to work through it with me. We're gonna define and clarify how anxiety and depression can impact patients that are living with other serious illnesses. We're gonna talk about the role palliative care can play in addressing depression and anxiety for people with serious illness. We're going to work through some of the most frequently asked questions. If we have time, we'll delve into some other questions as well. But we really sort of have a list of the ones that get asked the most, and I think those will be super helpful to you. And we're going to spend a little time talking about a fabulous resource for patients and families called getpalliativecare.org. It really is a website that, if you've been diagnosed with a heart problem, lung problem, cancer, something that's worrying you, take a stop over and log on to getpalliativecare.org. A ton of information for you there that will help on your journey through your illness. So let's start by talking about how common anxiety and depression are. We know from studies that anxiety is a common symptom. 25% of cancer patients, or like a quarter, half of heart failure patients, and half of patients with a lung disease called chronic obstructive pulmonary disease. So in 3 of the most common serious illnesses that we face as adults, a quarter to a half of us are experiencing those while also anxious. Depression is similar. Major depression is really common when you have another serious illness. 50% of patients with serious illness, at least almost 50%, no matter what the underlying diagnosis, experience depression while they're also experiencing their illness. So this is a pretty big problem. What are the symptoms? And this is an important slide, and I'll spend a little time here on it, because the one thing I'll tell you for sure is that when patients come to me as a physician, they don't come in and say I'm anxious. They don't come in and say I'm depressed. They feel helpless or fearful. People with anxiety, they generally describe being worried, fearful, helpless. They have difficulty sleeping, difficulty concentrating, nausea. They might be sweating, they might be short of breath. And look at those symptoms: trouble sleeping, trouble concentrating, feeling like you might throw up, sweating, or having some difficulty breathing. Those could be symptoms of almost any illness that people face when they get older or have a serious illness. So it takes some patience and concentration to weed out what might be anxiety versus what might be the underlying illness contributing to these things. It affects people across all aspects of their lives. Their physical, their heart might race, they might be sweaty. Psychological, they might be worried or fearful. Social, they may be withdrawn and not want to interact socially because of how they're feeling. Spiritual, people struggle with, why is this happening to me? Is this punishment for something? So there's spiritual aspects of anxiety. There's practical aspects, like, I don't want to be a burden on my family. How am I going to get to my appointment? How am I going to afford my medications? All of those things can be anxiety provoking. And then, loss issues, loss of independence, loss of work, maybe loss of identity. When we go from being a teacher and a marathon runner to a lung cancer patient, that's a big transition. So that's a big loss. Our identity changes, and the loss of that identity can be very anxiety provoking. So these are really profound things people feel, and you can see that they take a little bit of care and time to pick through to be sure we're clear on, is this just a normal reaction to an illness, or is this something more? And the same with depression. It's feelings of worthlessness, guilt, hopeless, helpless, people, stressing or keep, perseverating, or their mind racing over the thought of death. Finding no enjoyment in things that used to be enjoyable to them. This constant sort of dark cloud hanging over. Some people have intense depression, which is, with persistent suicidal thoughts. And they just, in general, they just don't have normal functioning because they don't have a sense that they have anything to look forward to. They're just in a really sort of gray or dark place that, without help from medical folks like myself, clinicians, they'll stay. And so the symptoms are easy to attribute to a bunch of other things. The symptoms are not such that people come in and tell their clinicians, I'm anxious or I'm depressed, but they're real and they're impactful. And keep these in the back of your mind. And if you're feeling any of these, have that, start opening up that discussion with your clinicians. So again, yeah, this is what I've been saying all along. They're not, the symptoms aren't visible. This isn't something where somebody walks, if you're at the mall or a ball game or something, you don't look and say, oh, that patient's depressed. Like, it's just not the way it works. It needs to be relayed by the patients to their clinicians or the other people on the medical team. Another way to pick this up is screening. So this is not really something that as a patient or as a caregiver you would be worried about so much, but as a clinician, it's first and foremost in my mind. I mean, it's important that I screen my patients for both depression and anxiety, even if my suspicion that they are depressed or anxious is not very high, because I know just statistically, nearly half the patients that walk into my office or that I encounter in the hospital are going to be depressed or anxious or both, because these often exist together. And every patient with a serious illness, heart problems, lung problems, kidney problems, cancer, they need to be screened because we know how prevalent it is, how much it exists out there in people with serious illness. So they need to be screened. So when you go to the clinician, chances are you're being asked, a 2-question inventory or maybe a 4-question thing, including, this might be routine. It might just be like every visit somebody does it, or it might be when you have a change in your disease or your treatment. Like if a treatment didn't work and you're trying something new, or if you're post-treatment and you're sort of entering into that worrisome zone of, well, when I was getting my cancer chemotherapy, I was seeing doctors every 2 weeks and it was very structured. And now they tell me I'm fine and I'm just supposed to go back to normal business. That's a hard transition for people and can cause a lot of anxiety or depression. And anytime people are feeling hopeless or helpless, worthless, guilty, having suicidal thoughts, these are super strong indicators that people have clinical depression that needs to be addressed, rather than this is just a normal response to your illness. So screening helps us to pick out those small differences. So, why is this palliative care doctor talking to me about anxiety and depression? Well, because I know from 20 years of experience, I know from, being part of CAPC and working with others in the field, that palliative care can help a lot when people are suffering with anxiety and depression while they're also living with a serious illness. But let's start from the first step. Like, what is palliative care? Well, we know that it's not well understood. So we defined it. And basically palliative care is specialized medical care for people who are living with serious illness. And it focuses on the relief from the symptoms and the stresses of the illness, and the ultimate goal being to improve quality of life for both the patient and family. We do this by providing it with a specialty trained team. This team normally consists of doctors and nurses, may have other specialists as well, social work, chaplains, pharmacists in some cases, but it's a specialty trained team from different areas of medicine who work together with all the patient's other clinicians and doctors to provide an extra layer of support. So you may have an oncologist like a cancer doctor, a kidney doctor, a lung doctor. And then you get referred to palliative care and you get this nurse and doctor and social worker in addition to all those other people. And it may be overwhelming, but this extra layer of support is really beneficial because palliative care really works to focusing on what your needs are because it's based on need and not prognosis. So if you're suffering with pain or nausea or other symptoms, palliative care can help while you're still getting all this treatment from your other clinicians. If you're fatigued, if you're depressed, if you're anxious, palliative care really helps with all that. And it can help coordinate the care with all your other specialists as well, so that palliative care can be provided along with curative treatment. And like I said in the slide previous, like we know that a lot of people don't know what palliative care is. You know, when we polled people, and this is a little old, but the statistics are still very similar today. When we asked adults 18 or over what palliative care was or how knowledgeable they were about it, you know, the majority of people either had no knowledge, didn't know, or somewhat knowledgeable. So that left, you know, about 3% that were knowledgeable, or the 3 to 8% that were knowledgeable or very knowledgeable. So that's not a lot. So, you know, not a lot of people know what we do. So what we went ahead and did in this national survey was that definition I read to you a couple slides ago about palliative care being an extra layer of support appropriate at any stage or any age in your illness. We told people that's what palliative care is. Boy, did they, you know, were they receptive to it? Like over 90% said they wanted to consider would be likely to consider palliative care for themselves or families. That same percentage thought that patients should have access to palliative care nationwide. And, you know, the majority also said that education about palliative care as part of treatment of a serious illness is important. And so, you know, it's interesting. Like, for the most part, we know people don't know what we do, but once they're told what we do, they really have a positive response to it. And I think the reason that that's the case is because when we treat pain, symptoms, stresses, the things that aren't like the physical, I mean, pain and symptoms are physical, but when we're not just talking about treating the actual illness, we're not just talking about treating the heart failure or the lung cancer or the lung disease. We're talking about what this disease is like to live with for you as a patient. And so, you know, treating the fatigue, treating the pain, treating the nausea, treating the stresses, doing all those things is just as important as treating the underlying cancer or heart failure or whatever itself. And we don't get taught that. Like in medical school, I didn't get taught to treat the person. We get taught to treat the disease. So this idea of, okay, we're going to treat the disease. We got great stuff. We've been, you know, we've evolved to where we can treat so many illnesses that previously were devastating, that people are living a lot longer or being cured with them. But what's that extra life like? Like, is that high quality? And that's where we come in. We want that. We think you should have both. Why shouldn't you live longer and live better? And that's really what this is about. So how well do we do as a health system to live longer, but also live better? And we don't do all that well. You know, if you're on this webinar, you've probably been through the ringer a little bit of what our health system is. You know, we have great things. We are a sick care, technologically driven, disease-driven system that does a great job with treating the underlying causes, but we shortchange quality of life. You know, because as I said before, outside of palliative care, we don't get the training to assess or treat pain, symptoms, and distress when it comes to serious illness. We're so focused on let's treat the illness, cure, or get this patient to live as long as possible. We don't think about those other things. But in palliative care, that's exactly what we're trained to do, is get you feeling as good as you can be while you're getting your disease targeted treatment. And we need to do better about these issues. I think we're getting there, but we need to continue to work at it to be patient centric. What is it like being you living with your illness, and how can I make it better for you? And it's not complicated. I mean, like I said, it's when people get sick, they want to be cured, or if they can't be cured, they want to keep the disease in check. And I want that too. I want my patients alive as long as possible, but I also want them to maintain good functioning and quality of life. I want them to be able to do the things that are important to them, because I think it's possible. I think it's possible to get the best of what we have to offer in terms of cure, but also help people maintain good function and quality of life. The other part of this that's super important is to have coordination and connection of care. You know, my dad, when he was really sick, said, you know, Andy, I don't need another doctor. I just need two that will talk to each other. And that's what, you know, I take that to heart in palliative care. Our whole profession takes it to heart, because coordinating care between all the different components that are involved in your illness, your heart doctor, your kidney doctor, your lung doctor, making sure they're all talking to each other and on the same page, not only coordinates care, but it makes patients and families know and feel like they are connected and contributing, and that everybody's on the same page. And that is such an important thing when we're living with a serious illness. And then the other thing, you know, people want is support to make informed decisions. Everybody who's got a serious illness is faced with, well, we could try this or this, and here's the pros of this and the cons of this, and here are the pros and cons of going the other direction. So palliative care a lot of times will sit down to help support patients and families to choose between decisions that might seem overwhelming given, you know, their level of understanding of healthcare and where they're at in their illness. So that's a part of what we do as well. And it's what patients want. So what's our role in addressing anxiety and depression? So Mike is a patient who has head and neck cancer. He you know, did well with treatment. In general, the type of cancer he had, very amenable to treatment, but causes a lot of pain and symptoms due to some of the radiation and things like that. Can be his treatment was a little bit disfiguring from surgery, and then some radiation and other things that made him, you know, really kind of struggle when we first encountered him. His oncologic follow-ups were going well. When he goes to his cancer doctors, you know, his disease was in check. He's doing great. He's, you know, really was doing well with his illness, but he wasn't doing well with you know, how he was feeling in his mood. And we knew this because his wife said he was withdrawn, he wasn't doing well. And when we screened him, he screened in for depression and we started treatment. And what happened was that not only was his oncology stuff going well then, he then started feeling back to himself. So even though he was in a remission status, he had done so well with treatment, he wasn't back to himself. It wasn't until the underlying depression was identified and treated that he felt like he could go back to work and do the things he was doing at home, and have his wife be able to acknowledge that, you know, she had her husband back. So the idea behind you know, treating somebody with anxiety and depression is that it's not easy to recognize. You have to go looking for it, and it can still be having a profound impact on somebody even when they're kind of at the end of their treatment or in a place where they're in remission or have very well managed underlying serious illness. That depression and anxiety can still play into it. So I want to go forward into some of the frequently asked questions we get about palliative care, because of the research that we did before. You know, up until this webinar, some of you may not have even really understood what palliative care was, so you may have questions. So let's work through these, and hopefully this will address the majority of them. So who provides palliative care and where can you get it? As I mentioned before, it's provided by a team of specialists, which includes doctors and nurses. Can include others as well, depends on where you're at and what that program has. And it can be provided in a number of settings. Probably the most common is hospital-based, but outpatient clinics and home-based palliative care are growing quickly. So more and more of those are becoming available around the country. And the easiest way to figure out where you can get it is to go to the provider directory section on getpalliativecare.org. You know, I was just on this about a week ago, and I looked in, I've sort of split my time between the Tampa, Florida area and Buffalo, New York. And when I looked in both of those areas, that directory was up to date and gave really good guidance on what programs are available. And so chances are it'll work for you as well, and I would encourage you to go there. So when do you need palliative care? One of the things we really try to stress is that palliative care is based on need and not prognosis. So you don't have to be at some certain level of sickness to get palliative care. All you have to do is not be doing as well as you could be. Because people who aren't doing as well as they could be doing have needs. That need might be a little bit more pain management. The need might be somebody to address your nausea. That need might be somebody to take the time to ask you about what's going on in your life and screening you for depression or anxiety. So you may need palliative care if you're suffering from pain or other symptoms like anxiety or depression, in addition to your serious illness or related to your serious illness. And sometimes we're even treating the side effects of treatment. This is particularly common in fatigue. So, it's based on need, not on prognosis. So you could have just been diagnosed last week. You're pretty early in your illness. Palliative care can still be a benefit to you to help work with your other docs to keep you on treatment for your illness and to manage the other symptoms that are going on at the time. So you can have it at any stage and at any age. And super important, you can have it along with all other treatment. It's an and, not an or. And that's really important that's a really important point of today that I hope people take away. Can you have it together with other treatments? Like I just said, yes. And I would say definitely, I view that as one of my main priorities when I have a patient that's undergoing treatment and comes to me in palliative care. So I'll use cancer as an example. If I have a patient with lymphoma who's undergoing treatment and they're feeling fatigued and they maybe have mouth sores or some neuropathy from radiation that they got, I want them to keep getting radiation. I want them to keep getting chemotherapy or, immunosuppressive therapy if they're on that. Whatever it might be that they're on, I want them to get whatever's going to help keep them alive the most. I just want them to be living with a good quality of life and being content with where they're at, like being able to live while they're ill instead of the illness defining them and really preventing them from living and having a quality of life. Because the goal is to achieve the best quality of life. Best of what we can do in terms of disease-directed and curative treatment, plus the best of what palliative medicine has to offer in terms of symptom management and quality of life. That's what we're trying to do. And I think that's reasonable expectation of a health system. Give me all you got to keep me alive, but do it in a way that allows me to have some quality of life that's acceptable to me and to live and enjoy while I'm living through this experience. And so, that's kind of where we set the bar, is to be that extra layer of support that allows this to happen. So what I love about the field that I'm in is that I help people a lot. I relieve pain, I relieve symptoms, I diagnose anxiety, I diagnose depression, I treat those things, and I get people living better. What's also interesting, and this is published in the New England Journal of Medicine, so sort of the quintessential medical journal. You live, like patients with a certain cancer lived longer with palliative care in addition to their curative treatment or their disease-directed treatment. So not only am I helping people to live better, I may be helping them to live longer. I help support their family, because when people get ill, they don't want to be a burden on their family. They worry about that a lot. So I can help support the family, so that becomes less of a worry for the patient. I know that the work I do helps people to stay out of emergency rooms and hospitals. And I know from 20 years of doing this and from reading the medical literature, people don't want to be in hospitals or emergency rooms. They want to be in their homes. And I help them to stay there. And so the other thing we do is reduce unnecessary tests and procedures. I don't stress myself about that as much, because I know if I relieve pain and other symptoms, maybe help people to live longer, support their family, that this other stuff about reducing hospitalizations and testing and emergency room visits, that's all bonus. I know it happens and it's good stuff, but if you do the fundamentals and really help people live better with an illness, this other stuff sort of takes care of itself. I get asked this a lot when I speak to groups. Should I bring it up to my doctor or wait till the doctor mentions it? This is a tricky one. It could be either. I don't think you should wait for a doctor or another clinician to bring it up, only because in medicine today, we see so many patients in a day. our mind's full of so many things. We're all human too. We have the things in our own lives that we're thinking of. You know, the subtle suffering or subtle lack of quality of life that you may be experiencing may not be apparent with all the other hundreds of things I have in my mind. So if you feel like you could be doing better, I always encourage patients to bring it up. You know, most of the time, the patients that I get referred to me come because the patient or the family had asked the doctor for a referral to palliative care. And I think we've evolved to a point where most other clinicians are starting to understand the benefits of palliative care and how it can help their patient while they're still treating the patient as well. And we're just like other specialists. So, you know, we need somebody to refer you to us. So, you know, either the primary doctor or you know, somebody in that primary care doctor's office should be making the referral to the palliative care team as specialists. So when and how should someone ask for a referral to palliative care? If you think you're not doing as well as you could be, if you have pain that's maybe not managed as well as you'd like, or other symptoms or stresses, I mean, ask. You know, come to us. If we can help, we will. And if we can't, I would be surprised, but you know, we would be honest about that as well. So, you know, we just are here for this extra layer. We're not asking you to give anything up. We're just saying we're here to help. We have expertise that comes from multiple people on our team, and we're really good at communicating with your other clinicians and coordinating care. And again, I would encourage you to go to getpalliativecare.org for more information. There's even a tip sheet on how to talk to your other clinicians about this, which I find really helpful. There's even like a quiz on getpalliativecare.org that talks about whether or not palliative care is right for you. So I would just spend some time on that site and get familiar. It's the most clear and comprehensive website on palliative care. As I said, it provides a definition, gives you the quiz, shows you how to get it, tips on how to talk to your doctor, some stories from real people that have gotten palliative care, the provider directory that I talked about before. I typed in the zip codes of the 2 places I've lived the majority of my life, and it was wonderful and accurate. And then there's a downloadable What You Should Know handout for patients and families about palliative care as well. So, you know, any takeaways I hope from today are recognize that anxiety and depression are subtle, and that, you know, like the responsibility for the patient and families to talk to the clinician about how they're feeling, and the responsibility of the clinicians is screen for this because we know it's common. So we need to look for it and be ready to address it. And then another take home would be whatever illness you have that brought you to this webinar today, get familiar with getpalliativecare.org. It's a great site, and things will be, you know, a lot more clear for you when you get familiar with that and the resources and the benefits of palliative care that are available to you. So patients often have, the takeaways, patients have anxiety and depression and other complex symptoms that need to be addressed. And I hesitate to say cannot be addressed by the primary doctor, but I would say a lot of times they're not addressed by the primary doctor for a number of reasons. We don't get trained like that in medical school. We don't have time in busy primary practices. It just may not be recognized because you need to screen for it. Like, this is not an indictment of primary care doctors. They do an amazing job, and they have an incredibly diverse amount of knowledge they need to know, but they don't get the training that palliative care specialists get to recognize this and screen for it. So, you know, that's a reason for referral to palliative care. We need to treat the disease and the symptoms. That's the only way this really works. We're great at treating the disease in the United States. We need to do better about treating the symptoms in the person. And that's what palliative care really aims to do. We want to improve the outcomes for people living with a serious illness, and, you know, encourage people if they feel like they should be feeling better, even if they can't put their finger on why. You know, ask for palliative care if you feel you need it, and use getpalliativecare.org to help you find the language to do so, to ask your other clinicians about it. So with that, I think I'm going to wrap up. We covered a lot of the most common questions. I want to thank everyone for being on the webinar today. it's normal for people with serious illness to feel anxious or maybe even to have clinical depression. You're not alone. We know it's super common. That's why we screen for it. There's no stigma to this. Just talk to your clinician about how you're feeling and talk to them about palliative care. And please get familiar with getpalliativecare.org. So thanks everyone for your time, and hopefully I'll see you soon on another webinar on getpalliativecare.org.